lunchtime web webinar from the Tackling Loneliness Hub. It's really nice to be here in Loneliness Awareness Week. I'm Helen MacIntyre. I'm Research and Development Manager at Neighbourly Lab, who currently run the hub on behalf of DCMS. And I previously worked as head of evidence at the Campaign to End Loneliness, who used to run the hub. And I'm joined here today by my colleague Ingrid, who will introduce herself.
Hi everyone, I'm Ingrid. I'm an independent researcher, research consultant working on wellbeing and loneliness, working with charities, funders and local authorities mainly. And I worked for 10 years at the Works Centre for Wellbeing as civil society lead. So a lot of the things we're talking about today were developed by me and Helen and our colleagues in those organisations.
Yeah, thank you. So I was going to sort of just say that we've been involved in a delivery of a number of sessions about various aspects of evaluation on the hub over the past few years. So given that it's a perennial issue, the sort of challenges continue to be sort of similar as the years go on, we thought it might be useful during Loneliness Awareness Week to revisit some of the ground that we've covered before. And as we do that, we hope that this will be a chance for you to think about your own evaluations, how you can navigate the challenges of the process, and perhaps how you can use some of the approaches and methods we're going to touch on. It's also going to be a chance for you to talk to one another and share some of those evaluation challenges during the breakout discussions. So as well as introducing yourself in the chat, please do that. You can post questions or comments there and we'll endeavour to answer them towards the end. And as we've collated slides from previous sessions, there's a bit of mixed branding on show in our slide deck. Hopefully that's not too distracting, but we've included links from those various recordings, blogs and so on that are already on the hub, and other resources that we think might be useful for you. And we'll send you the slides after the session so that you can check those out in your own time. Okay, so just to begin with a definition. So from the National Lottery Community Fund, they say that evaluation is a process that typically involves collecting and using data to answer your own questions about the quality, value and direction of your work to manage and improve what you do. So very much kind of an emphasis on making evaluation useful for the organisation that's doing it, and to inform the project that you are evaluating. And again, that's a this kind of learning circle of kind of design your project intervention, implement, evaluate, learn from the evaluation and improve upon your original design, kind of emphasises that evaluation is a thing that should be useful for you. But in reality, there could be various reasons why you want to evaluate a project or why you have to, and various audiences for that evaluation. And it's not always about your own learning. In fact, there can be a tension between that learning to enhance your own work here on the left-hand side and other purposes for evaluation. So you know, often it's about being accountable to various people, and often funders are requiring you to engage in particular evaluation activity. And then there's that kind of wider endeavour to create an evidence base that tells all of us what works best to reduce loneliness or other outcomes from your projects and activities. Okay, and this, I suppose this slide is kind of about that kind of common evidence base. And on the left, you'll see the cover of the previous government's strategy for tackling loneliness that was published in 2018. came out of the Joe Cox Commission on Loneliness in 2017. And it was world leading as a national strategy for tackling loneliness. And it was accompanied by the appointment of the world's first Minister for Loneliness. So within that, the issue of evaluation was addressed. And there was this kind of vision that if we could get everyone to use a common set of measures, then we'd be able to compare all the different kind of projects and activities that were going out there, that were being evaluated, and decide what worked best for reducing loneliness. But nice kind of idea turned out to be a bit oversimplistic, because very quickly people began to kind of wrestle with the use of these common measures. They perhaps were finding that the measurement that they were using wasn't reflecting the changes that they felt they could see in the projects that they were undertaking. So there were various conversations of that kind. And as a result, we at Works Wellbeing and the Campaign to End Loneliness were commissioned to do this piece of work by government, by the DCMS Tackling Loneliness team. And this kind of was to formally explore what the challenges were around measurement of tackling loneliness interventions. So I'm going to tell you a bit more about that piece of work. What we did, and you can find a detailed report about this linked on the previous slide, which is on gov.uk. But we spoke to about 100 people in the research. That was sector experts. We did 34 interviews with professionals who were closely involved in delivery and evaluation of particular interventions. And we did an online survey with 49 more professionals. So I'm going to talk very briefly about findings in relation to that piece of work. So first, we found something about what people were actually doing in terms of evaluation of their tackling loneliness interventions, and it varied. Some organisations were using the measures, recommended measures. They were using measures, some measures, and others weren't. Just under half were using one or more measure. For those that were using measures, it was mainly the recommended measures, the ONS measures, which I will come back to and describe in a bit more detail in a little while. But some were using different loneliness measures. Those different measures were sometimes like for different outcomes. So social connection or other well-being measures, or they were perhaps using their own measures which asked about the impact of their particular, of this particular project. Some were using strong designs in terms of showing impact, so with pre and post tests, sometimes with comparison groups. One of the organisations was building a large-scale longitudinal data set, but that was kind of quite unusual among the people that we were speaking to. No one was using loneliness measures on their own. And whether or not the measures were being used, there was typically use of qualitative methods as well. Often these were interviews. And those qualitative methods were often preferred to the measures for being acceptable to participants and for providing insightful information to the organisations themselves. So making it useful for the organisations and for the purposes of improving the project. Okay. And then there were these various reasons that were highlighted as barriers to the use of loneliness measurement. Sometimes there were reservations about using them because of organisational capacity. And that could be a particular issue when data had to be collected by project staff who didn't necessarily have the evaluation knowledge or training or indeed time to do the job. And where untrained project staff were collecting data, there were some questions about how rigorous that could be. Tied into this was the fact that many organisations didn't have specific funding for evaluations. Okay, then this second point. Some interviewees had concerns about the content of the loneliness measures. Not everyone, but quite a few people. And for them, there was a perception that asking people about their loneliness or their lack of companionship and so on could cause distress and make people feel stigmatised. And that might deter individuals who were perhaps already quite tentative about joining an activity so that they might never come back again. So that would mean that using loneliness measures was very much at odds with the core values of a project, which were to be kind and welcoming and supportive and responsive to the needs of participants. So in those cases, the use of the measures didn't sit well with the organisations themselves. Okay, third point about usefulness of the measures. Organisations didn't always think that the data produced by the measures was reliable or useful. That could be because they weren't sensitive enough to pick up on the impact of projects which were at relatively small scale. There was some specific mention of the UCLA 3 recommended measures as not being designed to measure change. Some interviews were concerned that the measure questions might not be well understood or be understood differently by certain groups, such as people with learning disabilities or people from different cultural groups. Another observation was that other factors in people's lives could often be contributing to loneliness, so obscuring any positive impact of the project or intervention itself. You know, so perhaps there were health issues or someone had suffered a bereavement that was kind of masking the benefits of actually engaging with the project. On the other hand, there was some mention of the fact that minimising this kind of noise of kind of external other factors in people's lives by pooling data from different similar projects could mean that findings didn't relate to the impact on loneliness in specific local contexts, which was often what organisations were really interested in. And finally, there was this issue of funder requirements for use of measures. So funders who we spoke to were really concerned to provide support for evaluation and avoid overburdening projects, but that wasn't always the experience of delivery organisations themselves or their evaluators. And there was a real sense from some of them that they put a lot of work into producing these evaluations, but that the data wasn't used or useful for anyone. You know, one remark about how these reports were produced year after year and then just put onto the shelf. And that could really be quite demotivating. So we came up with a set of recommendations as part of that work. I'll go through them quickly. The overall thrust was that they should be developed collaboratively, that evaluations should be developed collaboratively with input from all relevant stakeholders, funders and organisations themselves and anyone else that was involved. There was one specific recommendation about developing new guidance, one on co-production of evaluations and avoiding the kind of top-down, you must do this kind of approach. One recommendation on developing high quality training and support for use of a range of methods, and one on providing adequate funding for evaluation. And then in addition, we were recommending a review of the ONS measures, which again, as I've said, I will talk about a bit more in a little while. And that I know is ongoing at the moment. That is something that DCMS have commissioned. So exploring whether the ONS measures that are currently recommended are the best ones for the job. And then we also had this additional idea of exploring evaluation data to national data sets to increase insights. Okay. So I'm going to stop talking there and we're going to have a bit of time in breakout rooms where we're going to be asking you to introduce yourselves to one another, discuss with one another what challenges you faced when evaluating loneliness, tackling loneliness interventions. Have you found any approaches or workarounds that have been helpful in meeting your evaluation needs, given all the constraints that you might face? So I think Abba is going to put you in groups now,
Yeah,
and we'll see you in 10 minutes.
There you go. I think everyone should be assigned their room now. Great. So I'll put a time on for 10 minutes.
Right.
I think Annabelle is on her own.
Oh, where is her?
I think they're still closing.
Yeah, it always takes a minute, doesn't it? To close the room.
Is that everyone back, Abba?
Yeah, everyone's back.
Yeah, great. Okay. If you could just hold kind of important points that came up in your discussions there, and we hope that we'll be able to share some of those in a discussion session towards the end. But we're going to quickly spend a bit of time thinking about the evaluation process now and methods that you might use. There are links to a couple of sessions we did previously on the hub that kind of provide more detail on those. And I know I've now seen who's in the session, and I know some of you are very familiar with all this already, but anyway, just to revisit that, I guess, you know, you are thinking about evaluation in relation to your own needs, but whichever, you know, however you're planning to conduct your evaluation, I guess this slide is trying to highlight that you want to do something that's high quality and that's useful for you. You might want to think about a theory of change to consider how you want to bring about the change that you're aiming at. You're going to be wanting to think about the purpose of your evaluation and your evaluation audiences, and about the financial and human resources and constraints on the evaluation. So those are all kind of considerations that will come into play. And in the context of those considerations, I think we'd still be thinking, despite all the discussion about the kind of shortcomings and challenges around measurement, I think in an ideal world, we would still be suggesting use of mixed methods. So that's likely to be some combination of questionnaire data, which gives us numbers to help understand your participants and the extent of impact of your project on loneliness for particular groups of participants. And then that can be combined with qualitative data from interviews, focus groups or observations, which can add richness to our understanding of participants' lives and help to give new insight into how a project worked or didn't work and why. And then this is a possible overall design for your evaluation. So beginning with qualitative work, again, typically interviews or focus groups. This could be at the planning stage of a project, so that you can explore factors affecting loneliness of your project, and the impact for your potential beneficiaries. And you could use that early information to create a theory of change. Moving on to quantitative data collection, you'll be working to collect baseline data on loneliness or other outcome measures that your project will target, along with demographic information. And then at the point the participant leaves the project, you'll collect outcome data again, whether that's loneliness data or something else. And then in an ideal world, a follow-up, say 3 months later, to see if changes have been maintained or they might actually have been amplified as say social connection becomes embedded within the people who took part in your project. You may also be collecting comparison group information here. So in some cases that could be a control group. You could use benchmarking data as well. And then you'll be using interviews, focus groups, perhaps observations, again, to provide understanding of any changes. What was it that made a difference? What didn't work? How was the project experienced differently for different individuals and why? In that way, you'll hopefully have a nice full set of data to analyse and demonstrate how well your project has worked. Okay, I'm going to talk very quickly about quantitative evaluation, specifically the loneliness measures. So if you are going to use loneliness measurement, okay, I wasn't expecting that slide to be next. That's fine. Okay, these are currently the recommended loneliness measures. Still the ones that are recommended by government for everyone to use. And the measures have what are termed indirect and direct components. So these first 3 items are essentially the UCLA loneliness measure, and the scores for those questions are combined to give a loneliness score from 3 to 9. These ask questions about feelings of companionship and isolation, but don't use the term loneliness. The direct measure, question 4, is a single item that stands alone, and it uses the term lonely. The suggestion is that if you need to keep your survey short and you only want to ask one question, you should use that question 4. None of the others are designed to be used as single items. You should use all 3 for that UCLA measure. It is, however, possible, and this comes back to this comes to ethical issues. You might not like that direct question approach. Okay, and this is the slide I was expecting to see first, but these guides, one produced by the Campaign to End Loneliness, one produced by Works Wellbeing, give more detail about the ONS measures, how they should be used, but also some of the other main measures around loneliness, De Jong-Geerveld, the Campaign to End Loneliness measure, and the What Works Wellbeing guide also talks about other things that you might want to be measuring. Okay, and included there is one national loneliness measure for children, which is a kind of adapted version of the adult ONS measure. But I just wanted to highlight to you that there is a new youth loneliness scale in development from Pam Coulter and Jennifer Lau. And so you might want to watch this space for a really, really high quality youth loneliness scale measure that will be coming out for general use in the next year or so. Okay. I'm going to hand over to Ingrid to talk about other measures and other methods at this point.
Thanks, Helen. So I'm going to talk about other quantitative data you might be collecting as well as qualitative data, because as Helen mentioned, loneliness is almost certainly not going to be the only thing that you measure. So next slide.
Yeah.
Thank you. So pretty much all of you will be collecting both data on people's personal circumstances or personal characteristics, as well as potential other outcomes other than loneliness. And here I've put down the things that are not loneliness, but we know they're strongly associated with loneliness, and therefore you might want to keep a particular eye on these measures. So when it comes to people's personal circumstances or characteristics, we know that some demographics have a higher risk of loneliness. We know that, for example, women report loneliness much more often than men. And so some basic demographics are useful to track whether your particular group of people either match what we know from the national data or are taking a different route. We know, for example, that being single or widowed or living alone is associated with loneliness. And so understanding people's household composition might be something you want to measure. Similarly, we know health is associated with loneliness, bad health is associated with loneliness. We know that renters are more likely to be lonely than homeowners. And we know that loneliness is associated with unemployment and poverty. So there are personal circumstances that might form part of your demographic bit of your survey that you might be wanting to capture. And then in terms of other outcomes, well-being might be something you are trying to make a difference in, as well as loneliness. So loneliness might be, reducing loneliness might be the route you take to improving people's overall well-being and quality of life. And so measuring well-being as an outcome might be something that you either want to do or you've been asked to do because of your funding or other kind of program arrangements. We know that people who feel lonely are also less likely to feel that they belong to their local area, or that and are also less likely to feel trust in others in their communities. And so you might want to measure people's sense of belonging and trust. And there are good measures of this, and I'm going to tell you where to find those if you don't already. Next. And so the reason to measure these other demographic and outcome measures is that, first of all, they tell you whether you're reaching the right people. Are you reaching people who we know from their personal characteristics are at risk for loneliness? And that tells you whether your program is going to be effective in terms of their starting point. But it also starts to tell you why people might be feeling lonely and the pathways out of loneliness, as well as your impact on other outcomes. But it's these pathways that I want to talk about next. So next slide. Oh yeah, and the other thing to mention is that we know that loneliness is associated with transitions in life. So when your life changes, that becomes a risk point of loneliness. So we're talking about unemployment, divorce, changing jobs, moving cities, leaving home, going to university, changing schools. All of those transition points are high risk points for loneliness. And so understanding whether somebody is in a transition point and how far after that transition they've experienced loneliness might help you both in your design of your intervention and in your evaluation. So for example, if you want to understand whether someone's bereavement has led them to experience loneliness, understanding that transition might be part of your evaluation. Next. And so I just want to give you an example of a report. Well, first of all, it's a really useful report. It's a really well researched and reported piece of research that tells you a little bit about how this combination of measures can help you understand what's going on in your evaluation. So this is the Reconceptualizing Loneliness in London report, which was led by Neighbourly Lab with Campaign to End Loneliness and Works Wellbeing. And it looked at who is at risk of loneliness in London. And it found 5 big risks. So poverty, living alone, being disabled, going through life changes or being new to London, and feeling different or experiencing prejudice. So those are the things that were most associated in the data with people feeling what they call severe loneliness. And so understanding those personal experiences and characteristics might be something you want to do in your evaluation. But the report also looked at, well, why does, for example, being new to London lead to can be a risk factor for severe loneliness? And it's because when you're in a new place, you have low social connections because you don't know anybody. You might have inadequate support networks because you've left all of your supported family and friends somewhere else. You might have a low sense of belonging because you don't know the place and you don't have any connection to the local community, but you might have other psychological vulnerabilities as well. And so understanding that pathway into loneliness can help you understand your impact as well. Next slide. So there's for all of those measures and for a kind of a much bigger kind of explanation of loneliness and how it fits with other outcomes like well-being, I would recommend going to the online guide to measuring well-being, which includes, it's kind of a step-by-step self-guided tour to what do we mean by well-being and how do we evaluate it. It includes a well-being measures bank, which includes loneliness measures as well as measures of trust, belonging, a bunch of other stuff that's relevant to people who do tackling loneliness interventions. So that's a really good resource to explore at your own pace. Next slide. Yeah. And this is just so that you've got them on a slide. These are the ONS subjective wellbeing questions. These are our national wellbeing questions. You may have seen them. When we talk about measuring well-being, quite often we're using these questions, but these are not the only ones that are on that measurement bank. Next. So I want to briefly talk about qualitative evidence, because as Helen mentioned, most people who are doing loneliness evaluations will have some qualitative data going into them as well, because it's almost never enough to know whether loneliness went down. You also need to know how and why, because otherwise you can't improve or replicate what you do. And I think there's a huge amount of hidden wealth of qualitative evidence in the work that charities and local authorities and others do in reducing loneliness, and we're just not capturing it. And so this is my kind of plea to kind of pragmatic qualitative data collection, to include that in your loneliness evaluations, because it's really, really valuable. So next slide. We know a lot about how people experience loneliness, but loneliness is very personal, and people's feelings and emotions around loneliness are complex, and they change, and understanding that personal, subjective feeling and emotion around loneliness is really important. So those are the kinds of things that you get from qualitative data. Next. And qualitative evidence, as you know, is people's experiences, their opinions, their personal stories. They help us understand why they feel lonely and how that experience might change over time. And it gives you that depth and that detail around the quantitative data that you might have. So if your quantitative data doesn't make sense, your qualitative data generally explains it. That tends to be kind of the way people sometimes use qualitative data. You can also use it to develop a theory of change, the way Helen mentioned at the beginning. So you can use it to help you plot that journey towards reductions in loneliness that you might use to design your activities. And you might collect data from interviews, focus groups, but you could also use creative methods, personal diaries. And I'm a big fan of capturing this thing called capturing casual moments. So Helen, just click next minute. Yeah. Oh. So I think there's a bunch of qualitative data that gets lost because it happens in these kind of informal conversations at the tea point or at the end of a session on the way out, that aren't part of the official evaluation, and they're not part of the official kind of intervention activity, but they're really rich because people feel less pressure to say something interesting or meaningful about how they're feeling. And there are ways of capturing those kind of informal and casual moments to help you with your evaluation and with your with designing your activity. So I've put a link here to Evaluation Support Scotland, who have a really cool little guide and template. And the focus group is also a link to a hub resource on focus groups from last year or a couple of years ago.
Yeah.
Next.
I'd just say that Evaluation Support Scotland I've looked at before, and I think it has a whole batch of useful information. I remember something on research ethics for voluntary sector organisations.
They're fantastic. They absolutely, I think, are leading the way in evaluation support in the UK at the moment. So yes, do have a look at their stuff. Next. So the main purpose, I think, of using qualitative data is to understand this ways into and ways out of loneliness. So this, you may have seen this image before, is this kind of downward spiral of loneliness. It comes from the Campaign to End Loneliness, Psychology of Loneliness report, and it explains how loneliness becomes this kind of negative, self-reinforcing spiral where things get worse unless something changes. And understanding that intervention point and that kind of thing that breaks someone out of a spiral is the really important thing that you can get from qualitative data. So if you click next, I've got a couple of quotes. So qualitative data from the Psychology of Loneliness report. So one of them talks about you have to have a purpose. You have to have something to keep you going, whatever it might be. something that keeps your interest, in this case knitting. But then you also, for example, this other person talks about having a routine. I have a little routine every morning, I make myself do this and I feel better for it. And so that your conversation with somebody in interviews and focus groups can start to draw out how people loosen themselves out of this spiral, or how your activity helps kind of redirect them to more positive ways of thinking or to closer relationships with others. Next. And so using your qualitative data, you might want to put together a participant case study. Here's how you start to link it to your specific activity. So you might want to ask people these things. You might want to ask their motivations for getting involved. In terms of the outputs of your project, what they valued about the project. This might be the activities or the atmosphere or anything like that. And you might want to ask them what change they think your project made. So at that point, you're asking them to attribute a change to your project. And then I think it's really important when you do case studies and interviews to ask them what would have happened if you hadn't been here, which is a kind of a way of doing a counterfactual and qualitative evidence. So what would you be doing if you weren't coming to this group every week? And then asking them what they might do next. How will this change to kind of that longer term behavior change that we know breaks people out of loneliness spirals? Next. But you also might want to put together a case study of your project itself. And this is kind of drawing together any quantitative data, any qualitative data, any insights you have about how your project worked and why it worked and what you would advise others to do. And so this is a guide, this is a hub resource on a guide we put together on how to write a really good project case study. And if there are any funders in the room, I think these are really useful, so you can look across a group of projects that you fund and bring them together and draw out all the kind of key ingredients and all the really important learning from all kinds of different evaluation methods. Next.
Oh,
I think you've stopped sharing. But actually we could stop sharing altogether, because we're now gonna take your questions and comments, and also want to hear a little bit about whether these methods are relevant, whether you use them, what would help you use these kinds of methods, and what you might do as a result of this session as well. So yes, any questions or comments from anybody?
Or feedback from your conversations earlier. Be nice to hear what challenges you were facing and whether the methods that we've discussed just now are going to be helpful for you.
Yeah, Georgina.
Yeah, just saying hello to everybody. Yeah, I was in a room with Cherry, so we both work with older people, so we were just talking about the kind of usual issues in terms of capacity and resource to do these kinds of things, but also for us in particular, kind of the best ways to reach people, and whether, conducting surveys online and even in person and over the phone, it can be difficult to ask these questions. So I'm not sure we came up with any solutions, but we did find that we had quite common difficulties, and that there was almost a kind of, there was asking standardized questions, and there was insight into how people felt about the services, and actually making those two things meet was quite difficult, because there are, as we've seen, there are just so many different things at play when people are thinking about how they feel and what their life is like. And so yeah, well, personally, I'm invested in the kind of a shared evidence base, but I agree with what you're saying about the qualitative data. That's where I think the real insight, particularly for a service, is. So yeah, just a comment really.
Yeah, thank you. Cherry, did you want to add to that as well?
Yeah, just to add to what Georgina was saying, yeah, we had a really good discussion, but you've given us so many good resources there that we can go and have a look at. I, for one, think we can certainly tighten up our the way that we ask our people at the moment. You know, we just use a yes, no kind of evaluation, but I think we can go a little bit deeper and maybe change the questions a little bit. I think the organisation's been using this particular system for many years, so I think there's definitely a need to maybe change that. So yeah, thank you.
No, thank you. And I think actually that's quite a useful point to raise, because quite often you've got many years of data on using a specific question. So it's quite hard to just like change completely.
Yes.
You lose your time series. So I would say don't necessarily like rush to change it completely, but having that conversation to say, what else could we add? Ask that might give us a bit more, that might fill in those gaps.
Yeah, that's right. Yeah, and I think going forward, you know, once we decide on something new, then going forward we could use the new system and then figure out a way to integrate the old system. Yeah. Anyway, thank you.
There anything from any of the other groups? Main kind of themes that came out?
Well, I mean, I think there was a consistent comment in our group. Ed, help me out here. The use of the what works wellbeing stuff. David, I think we both found that very, very useful. And it's certainly beneficial when we have conversations with our voluntary sector partners. And I talk about using that whole system in terms of the evaluation process. So we're not just saying loneliness, we are looking at issues of, you know, crime and disorder, sense of belonging, identity, and all of that, the subtleness of evaluation. But I mean, there's still, I'm experiencing, there's still a significant issue around the stigma of loneliness and people not wishing to even acknowledge it, admit it, accept it, or say they are experiencing it or have ever experienced it.
Yeah.
Yeah, I think we were talking about the reluctance of some people, even within our teams, to kind of put out evaluation surveys about their own interventions because they're worried it might be triggering or because it might be somehow contributing to it rather than helpful. So how we evaluate as part of a broader theory of change about our effectiveness is something that we're working on at the moment.
Georgina, did you want to come back on that point?
Just it's something that we did a lot of thinking about a few years ago, and we kind of looked at doing post evaluation of how people were feeling before, rather than asking them at the time when they applied. What we've landed on is ensuring that we're only asking those questions at the point where somebody's been matched into one of our services. So they might have applied, you know, several months previously. We're not asking those questions at the point where they're feeling they might be in crisis. We're asking them at the point where we're able to tell them we've matched you into a service. So that for us felt like a more positive point at which to be asking those questions. And obviously people can tell us that they don't want to answer the questions if they don't want to. But yeah, just in case that's helpful at all.
I do remember you saying previously as well that sometimes we're more sensitive about asking the questions than participants are about answering them. So it's not necessarily the issue that we think it is, and that there needs to be a lot of emphasis on how you ask the, you know, the kind of I suppose the atmosphere in which you ask the questions and asking them in a kind.
If it reassures people, the evidence, especially on well-being, says that people want to talk about it. They think it's important to talk about. But yes, one of the things that doesn't work is if the questions get dumped in the middle of a survey and you've been asking people about their reading habits or their knitting, and suddenly you ask whether they're lonely, and then that's a bit weird. So just kind of thinking about where to put it in your evaluation, in your data collection and things like that, as well as when to ask it. I completely agree, Georgina. there are people who don't ask it at the first session, they ask it at the second session. As close as possible to the beginning as is ethical and would work, I think is kind of a rule of thumb. And the other thing is, yes, actually talking about loneliness makes people more self-aware. So one of the things we see is loneliness in your data. It might look like loneliness gets worse before it gets better, because what's happening is people are more aware of how lonely they were feeling. It's not that it's not like you're making it worse, but you are increasing people's awareness. And that thing, I think, is important to keep in mind when collecting data.
We're almost out of time, but let's we can carry on for 5 minutes, I think, if you know, for those that can manage to stay as well. Bill, what did you want to come back?
I was just going to say, some area of work we've been trying to change the narrative. I've been trying to change the narrative around loneliness and isolation, and looking at the issue of social health. And we talk about loneliness, and we talk about, you know, are they elderly? Are they 16 to 24? Are they, you know, poverty, etc., etc. We all have the ability to improve our social health. And in terms of that as a conversation starter, a metaphor, it gives me that space in which then to say about improvement of social health is about reduction of the experience of loneliness, and start to have those conversations. I was saying to the two guys that I don't know how many times I've been out in the public arena and people say, well, I can't be lonely, I'm out, I'm here today. So
yeah, that's a really interesting insight. Yeah. David, did you have your hand up as well?
Well, if we've got time, just to reflect on a few of the challenges we've had in East Sussex in kind of developing a programme in collaboration with the voluntary sector, where we're trying to create a systems approach to tackling loneliness. And we're trying to embed an environment where evaluation happens and where insight gathering happens. We used the Works Wellbeing measuring loneliness guide to create our own locally endorsed, more succinct guide. We try to make it as short as possible and usable, while still being hopefully robust. You know, recommending the right measures to use and encouraging people to use those. And we're also kind of developing some local insight gathering as part of the programme directly. I suppose the challenge is we've created this guide and put it out there. I don't yet have any feedback on how that's been received and how much it's been used. So we're doing an evaluation of the programme overall, which will hopefully find out more that's more on that and more on the insight gathering and the success of that. But definitely the tools and approach today is a really helpful summary and gives me reminders of things we need to continue doing and build in as well. So
we'd be really interested to hear what the uptake is of that and how that goes, actually. And also back to Bill's point, yeah, I was talking to Ingrid about how actually the questions in the kind of formal measures can be used as starters for conversations, for qualitative conversations. You can kind of administer the measures, and then actually that opens up all sorts of avenues for conversation about people's lives. So
I was going to mention that, actually. Yeah, I forgot to mention that. So if you look at the 4 national measures, the 3 top ones are about emotional and social loneliness. So you could take those and use them to structure conversations. Is it about feeling left out? Is it about companionship? Is it about isolation? So you can use those, not like directly as qualitative interview questions, but you could use those to say, have I asked about all the dimensions of loneliness, the social bit, the emotional bit, as well as some of the other things? That might be one way to kind of use the two.
Right. Thank you so much. It feels like the conversation's just beginning and now we have to stop. But Abreu, I think the conversation can be continued on the hub, can't it?